So this presentation indeed is it goes to go to remote public interpretation remotely. So with the help of training, I'm not the only person to work on this project. So I introduce you to my colleague, Nuevo Dulce Domingo, interpreter, and doctor in cultural interpretation, in charge of a class and remote professor at Valence University, François René Ducotre, collaborator for many years on all projects that I'm doing on interpretation. He is a research professional here at the university. Suzanne Gagnon is the physician in charge of the clinic in Quebec. Kousigan Kourou Kupulu is my young colleague here, professor, has statistics and clinical competencies. And I'm happy, and of course, I'm the person responsible for what I'm saying. The plan for my presentation is quite classical, so I won't spend too much time on this, but I'd like to thank Dialogue McGill for the invite and for the financial support for the project to improve the access to the care and to the population that needs it very much. With the two previous presentations, I'd like to specify immediately that it's not a matter of a project or presentation that targeted essentially Anglophones. It was for all people that did not speak French in Quebec, and it did not target mental health either, but all health services, including mental health services. And we saw to what degree there was a need for mental health as well. So for a brief introduction, we can talk about globalization, migration, more particularly in some of the countries. There's also internal diversities with the Aboriginal, Indigenous. So all of these cultural and linguistic differences makes it that we need to have laws that require us to offer services in all these. And all this impacted the last 20, 30 years to get interested in the interpretation of public services. But for me, it's always an intercultural interest, and why there are needs there. And some of them that will all completely ignore that aspect where you cannot skip that, because if you offer services, at some point you'll have to require services of an interpreter. And more recently, since the beginning of the remote working with the Bank of Interpreters, and during the pandemic, like all institutions in Quebec, found themselves with huge challenges, having to supply interpretation while still being locked in their home, confined. And so we had to go to remote interpretation. So there was almost nothing that had been done in Quebec on the remote interpretation. And it's nothing much is offered in terms of interpretation training in Quebec, but more particularly for the remote interpretation. So just to make sure that we are all talking about the same thing, can you still see my PowerPoint? Yes, okay. It seems to be okay, yeah. The interpretation of public services targets to increase the quality of intercultural or cross-cultural communications between the speakers with a secondary speaker who's the interpreter. So when we say secondary, it's not less than the others. It's not a matter of value. It just means that he's there to convey the message from one to the other, and that the primary discourse is by the users of the dialogue. But that person plays a major role, of course. And what do we mean by the remote public interpretation? Like in a situation that we have now, we're all remote. It's technologies in telecommunication to make sure that this interpretation can take place. There's a researcher that's called Rizo Akis who describes remote interpretation, and he describes especially, he talks about a notion that's called the virtual presence. For him, it's the way to describe what's happening in remote interaction. It has physical and psychological impact in the interaction, especially for the interpreters. So we'll go more in detail with that, with the consequences that it can have. It has a huge benefit to know that if we want to be able to interfere at long distances, it's essential. But it also has not as fortunate effects on the interpreters, physical and psychological for the interpreters. Even there's a feeling of alienation for when they have to work remotely. And I'll get back to that a bit. And just before the pandemic in 2018, the MIDI, which is the Ministry of Immigration, had asked to establish recommendations for remote interpreting. So we did that work with François-René de Courtrai, who is present as well, Andréane Baudouin-Julien, sorry. And so there was a list of 35 recommendations on remote interpreting that were published in the State Review. And we didn't just look into that, but we also worked with a group that was called the Service of Help to Canadians from Sherbrooke, who has for a mandate to welcome immigrants or refugees in the Sherbrooke area. So we conducted focus groups to adapt to those and to the Quebec situation. So I can give you a few examples. With the notion of virtual presence, you have to provide for a work environment that is appropriate. You cannot interpret while children are watching TV, for instance. It seems obvious, but at some points, the interpreters are forced to act very urgently, and sometimes that happens. One of the recommendations is to make sure that the manager of the interpretation center to make sure that the interpreters have adequate working conditions. Another recommendation causes the interpreters to use the remote presence less is that they often have the same sound and things that the other people are here, but they don't have the resources to interpret with. Sometimes there's this resonates in things that they have gone through as well. But to offer the support and supervision, it's that much more necessary at all times. And then another recommendation was to offer training for the interpreters and the members of staff involved, because any person that's bilingual is not an interpreter, and you need to have a training for that. But to do it remotely involves having technical knowledge and professional know-how, which is additional to the one of just doing it in person. And so it's good because this is exactly what we're going to do, what we're doing. Another recommendations that I have is to offer the training. I've seen that in my research for decades now, to have a quality interpreting and an intervention interpreted with quality. It requires time. I know it's there is a lack of time, but you need to prepare the interpretation and the intervention by discussing with the interpreter ahead of the intervention or during the and you need to have time after the intervention to make sure that the interpreter is doing well. There's nothing that should have been added. So it's always a matter of additional time that is required to study all that, make sure of all that. And I cannot move my slides, sorry. Is it working? No, it's not. What's happening? So here we go. So in the urgency of the pandemic, given that there were some emergency measures that were implemented, we had to interfere remotely, and that the populations that were particularly vulnerable were the ones that normally have difficulty in accessing these services. So that it was that the problem was amplified. It was that much more difficult. So we figured that we would invent two trainings, one for the people to teach them how to interpret remotely, and to provide them with some very practical ways of dealing with the interpreting. And during the pandemic, we didn't want to overload those people that were participating and that were over-solicited, given the emergency of the situation and the context at the time. So we wanted to have a research aspect, but it was modest. So we wanted to measure the impact of the training with the knowledge to see if they were improving, and also with the feeling of self-efficacy. And the literature said if we measure that, we have the chance of knowing that what was learned is going to be put in practice. So it's self-reported, so we don't really check if it's put in practice, but it's a measure that is self-reported, that is very closely correlated with what's put in practice. The trainings that we have were put together and given by somebody who's an interpreter, who worked as an interpreter for a long time. They were analyzing technical and communicational aspects, and we tried to do it in a synchrone mode and asynchronous, but it wasn't working. We required a minimum of interaction. So for the people working, it was brief. It was 45 minutes. It was somebody who was exposing the facts with a Q&R. It was given twice, summer and fall 2021, with the help of CERDA for the broadcasting. 208 members. 1,000 people are members of that network, and these people are able to interfere. And we had quite a few people who registered, 208. And so for the interpreters, it was more interactive to provide them with more technical knowledge.
So this course was given 5 times. So we were able to have a prolongation of the project. Thanks to McGill, well, we managed to get more interpreters, because with the first years, with the 2 seminars, we didn't have a lot of interpreters. So we had to make more efforts to go recruit them. Still, we had quite a few registrations. So we had a social demographic questionnaire. These are the 2 scales we used. And we did it 3 times before the webinar, right after the webinar. And we also recontacted the participant 3 months later on to see if they still had in mind those knowledge and if they were using this knowledge that they had learned. And we did statistics on this. So this is for the interveners, the statistics that we obtain. You can see that on the 208 registered, not everybody answered the questionnaires, 79 and 33 and 32 and the others. And I put all this socio-demographic data to show you that there's no difference in the populations. Statistically, we can make comparisons. Well, the population does not change characteristics. I just wanted to draw your attention a bit of your data. You can see it's mostly women, and it's mostly people who have never been trained to work as interpreters. So it's something which is greatly lacking in the basic training of the interveners and half had intercultural training. Even if they were involved in intercultural intervention, only half of them had any training. Now, for the interpreters, roughly the same number of respondents, and 26 in the third. And here too, it's mostly women. It's also mostly people who were not trained to be interpreters. So these are just people who will intervene as interpreters, but they have no training as interpreters, or at least minimal training. Since the Bank of Interpreters for the national capital, there's a minimum training that's required, but it's just 1 day of training. It's not a complete course, obviously. And these are people who have schooling, which is, or half of them, they didn't go beyond secondary school. It's quite a specific population, which gives huge services to the Quebec population, the most vulnerable population, but themselves are in often vulnerable and difficult situations. So the results, you can see that we have a good effect on the treatment. There's a difference on knowledge, and the difference is persistent between time 1 and 2, and it's a difference which maintains itself over the time 3. And also for self-efficacy, they feel more competent right after, but 3 months later, they continue to feel more competent. So probably they are using the knowledge that we transmitted to them. Great. For the interpreters, it's a bit different. For the knowledge, we have the same results after the training. And the feeling of self-efficacy disappears after 3 months. And probably, this is my explanation here, we are at the discussion. So our hypothesis is confirmed, well, at least 3/4 of it. But the interpreters, or the interpreters, since there's this reduction, they have the same knowledge, but they have difficulty implementing this knowledge. This is what the result says on self-efficacy. And as I've shown to you, this is a specific population and they would require accompaniment to improve their practices. It's a population which is not trained for interpretation. And even if they receive a bit, half a day webinar like this, it's not enough. We would need accompaniment for these people. And generally, we would need a standard training, stabilized training for interpretation of public services in Quebec. Yvan? 90 seconds? Oh, I'm finished. I just want to talk about the interveners. Such a training has beneficial training, even in midterm. But if we look at scientific literature, I'm thinking about a research done by colleague Maurice Weber. He did this type of training, not necessarily for remote interpretation, but he also took measures like this over a longer period of time. And he sees after 1 year that the knowledge are dissipated and the practices come back to the previous models. No, they come back to what they did before the training. So here too, we would need coaching. I wrote partnership because inside the institutions, there should be communication on the possibility of working with interpreters, reminders, and so on, little guide to facilitate communication with the interpreter, things like that, to make it normal and not like something which is marginal, so to speak. I'm now finished.